I want to welcome you to our new office in Wellesley, Massachusetts. I'm Dr. Peter Coleman, the founder and National Medical Director of the Coleman Institute. Since 2002, we've been helping people get off opioids and get into long-term recovery. I've been in recovery myself since 1984, and since that time I've been working in the field of addiction with all drugs, but particularly with opioids. In the late 90s, it became clear that there was a huge problem with opioids, and that's gotten worse and worse ever since. We've been able to develop a unique outpatient program that helps people get off opioids and get completely free in 3 to 5 days. We use comfort meds and we use microdoses of naltrexone in order to help the brain heal a little bit quicker and get on to long-acting naltrexone products such as Vivitrol. It became clear to me that patients particularly wanted to be completely free, and without some form of medication-assisted treatment, they were very often just not successful. So we started using long-acting naltrexone products, and in particular Vivitrol, starting in around 2005, in order to help people. Vivitrol is great because it occupies the opioid receptors, and it pretty much takes away all cravings. So it helps patients be able to get into treatment and be able to concentrate on their recovery and make the changes necessary to help them stay in recovery long term. Our program was so successful, in fact, that in 2005 we were asked to set up a satellite clinic in Southern California. So we did that by training a doctor out there, and since then we've opened up 12 offices in different parts of the country so that we can help people from all over. I'm very happy with the outpatient alcohol detox program that we have. Coming off of alcohol can be particularly dangerous. Patients can have seizures, or they can even go into delirium tremens and have other major complications. We've developed a 3-day outpatient detox program where we have patients in the office on the first day for 6 to 10 hours. We're able to keep a close eye on them and watch their vital signs and give them medications including phenobarbital, which is a great long-acting sedative and an anti-seizure drug. It goes to the right part of the brain to help decrease withdrawal symptoms and make sure that they stay safe. We keep a very close eye on them, and then we see them for the next few days to make sure that everything is smooth and their detox is going well. Patients love it because they don't have to stay in a hospital. They can detox in the comfort of their home in the evenings, surrounded by their friends and family, and so they really appreciate this program. We're delighted to have our new office in Massachusetts. There's a huge problem up there, of course, like there is in all parts of the country. Patients can really benefit from long-acting naltrexone to help them get into recovery and stay in recovery.
Hello, my name is Dr. Deborah Reich, and I am the Medical Director at the Wellesley office of the Coleman Institute for Addiction Medicine. We are pleased to offer our outpatient withdrawal management services to the Boston area as well as the greater New England region. My interest in addiction medicine began after a long career in anesthesia and pain management. As a practicing pain management physician for greater than 20 years, I've had a great deal of experience prescribing prescription medications for acute, chronic, as well as cancer pain. Although the medications are necessary for many disorders, I also saw how they could be misused and turn into severe substance use disorders. There's a tremendous amount of suffering that happens both on the individual and the family level when it comes to these problems. The Coleman Institute treats both opiate and alcohol use disorders in a safe, comfortable, and proven way. The Coleman Method has been used for over 22 years in the United States. If your problem is with alcohol, prescription or non-prescription opiates, we can help. If you have been on methadone or Suboxone maintenance and wish to comfortably and quickly come off of those, we can also help. Your detox will be followed by 6 months of Vivitrol injections, as well as personalized case management services. Together, we will develop a recovery plan that makes sense for you. Let us help you find your way back to living a healthy, full, and joyful life. The path begins here. Recovery is possible.
How it works and what to expect. Before the detox begins, patients have a telephone screening evaluation by a physician or nurse practitioner. All patients must have an identified support person that will accompany and transport the patient to the office each day of the detox. the patient receives instructions on when to discontinue their alcohol and opioid use before the day of their scheduled detoxification. On the first day of treatment, all patients will receive a thorough history and physical exam. Blood work is drawn, an EKG is obtained, urine drug screen, and breathalyzer are recorded, and other labs are taken as necessary. After their history and physical, they are given a number of medications to help them be comfortable and minimize their withdrawal. They stay in the office for a few hours, so there is plenty of time to answer any questions and make sure they are comfortable. For an alcohol detox, the longest day in the office is the first day, whereas for opiate detox, the longest day is the last day. The long day is where the patient is in the office for 6 to 8 hours. They are administered medications through an intravenous line, vital signs are taken regularly, and the patient is closely monitored throughout the day by our medical team. We have comfortable observation rooms that include access to Wi-Fi, smart TV, and lunch is catered. During the intermediate days of treatment, a patient can expect to be in the office between 1 to 3 hours. The patient and support person meet with the provider to discuss treatment progress. Doses of medicines are reviewed and adjusted daily based on the patient's symptoms and comfort. Patients will meet with our case manager to develop a plan for long-term recovery. They will provide naltrexone therapy education, tools and resources to identify and manage post-acute withdrawal symptoms, and relapse prevention planning. By the end of the detox, the patient's opioids are removed from the brain and the alcohol is removed from the body. We review and agree on a comprehensive treatment plan for long-term recovery. We administer Vivitrol, a non-addictive opioid blocker that reduces a patient's cravings for alcohol and opioids and blocks the effects of opiates. Plans for follow-up medical care are established and the patient is discharged. Case management services will follow the patient for the first 6 months after detox. They will support and navigate the patient to ensure they are connected to pro-social recovery supports. The patient will also meet with a provider each month and receive Vivitrol maintenance.
Hello, my name is Amanda Pitts, Executive Director at the Coleman Institute for Addiction Medicine in Wellesley, Massachusetts. We are very excited to be here in the Boston area and offering outpatient accelerated detoxification services. As a clinician in the field for the last 17 years, I completely appreciate that one size does not fit all for treatment for individuals with alcohol and substance use disorders. Benefits of the outpatient Coleman method include there is no hospital or inpatient stay, and a patient can detox comfortably in their own home. Our detox takes as little as 4 to 8 days to complete. Due to the customized medications that we use in treatment, we reduce overall discomfort for a patient, and we have a 98% completion rate. At the conclusion of the detox, we offer Vivitrol, and we have monthly Vivitrol maintenance. In addition, we have 6 months of case management support to really help an individual to succeed in long-term recovery. Thank you so much for taking the time to view this today, and if you have any questions, please feel free to reach out to us and we'd be happy to help. Thank you so much.
Hi, my name is Mike. I'm 33 years old. I've been an addict for going on over 10 years now. It's been a hard road, but coming to the Coleman Institute has changed my life around. I mean, I'm a completely different person, and I'm just feeling great, and I would recommend this to anyone. I've tried going to cold turkey before. It didn't really work past a week. I just struggled really hard with that. I also went to a rehabilitation facility, struggled with that, just being away from my family and just not having the support system I needed as far as my close family and friends. So from there, I went to methadone, which did really well for me. I mean, like when being on it, it did help me get stable and stop using other things, but it just became very, very difficult to get off of, to the point I just felt like I was chained to it and I was never going to get away from it. So I just started Googling one day and was like, I need to find something I can do, and just stumbled upon the Coleman Institute and read about it, watched some testimonials. I'm like, I think that's the place I need to go to. And I think the next day I called and made an appointment, and the next week I was here. I mean, it went better than I thought it was. I thought it was going to be horrible and I was just going to be, a mess the entire time. But with the comfort medications they gave me, dealing with it and just talking me through everything, just really calmed me down and just made the whole process so much easier. And every day since then, it has been getting better and better. I don't have any cravings. I have no desire to use.
You're worth saving. Life is worth living. No financial burden, no family stress is worth giving up. Life is best when you can enjoy it clean and sober. And it's been a long time since I've been able to see the world as it truly is. And it can be there for you too. You have to make the first step. You have to come through the denial, bypass the anger, and hold your hand out for help. And the Coleman Institute has a hand willing to help you on your journey.